My name is Jacqueline Felix, and I work as a compliance specialist in OHA's hospital staffing program. OHA's hospital staffing complaint system is how Oregon's hospital staffing laws, including the updates in 2023's HB 2697, are enforced in Oregon. In this video, we will describe who is covered by the hospital staffing law and explain which types of staff are included in the staffing plans. The hospital staffing law covers nursing staff members. Nursing staff members are defined in statute as RNs, LPNs, and CNAs who are primarily providing direct patient care. This includes care provided in the main hospital building, in spaces operating under the hospital's license on the hospital campus, and at any off-campus clinics operating under the hospital's license. This can include both inpatient and outpatient services. When evaluating whether individual roles should be included in a nurse staffing plan, there are several key factors to consider. First, does the role require licensure as an RN or LPN or certification as a CNA? If these professional qualifications are not required, then this is not a nurse staff member position. Second, does the role involve providing direct patient care? If it does, the role may require a nurse staffing plan. Third, consider what happens if a staff member in this role is unexpectedly absent. If the hospital routinely reaches out to find a replacement to fill the role with on-call or volunteer staff to maintain patient coverage, this suggests the role is essential and likely requires a nurse staffing plan. Lastly, consider whether the staff members in the unit are assigned to work with specific patients for all or even part of a shift. If they are, this is an indicator the role is likely a nursing staff role and would require a nurse staffing plan. There are non-nursing staff members whose work is integral to the work of the nursing staff members. These other type of staff may be covered in professional, technical, or service staffing plans. For example, a unit secretary may fill a crucial role in an inpatient unit, and this role may be filled by an individual who is not an RN, LPN, or CNA. The unit secretary role could be included in the professional, technical, or service staffing plan. Unlike the nursing staff plan, the rules for professional, technical, and service staffing plans are determined through the hospital's collective bargaining agreement with the union. The union contract determines who are professional technical staff or service staff, depending on the language in the agreement and the roles it covers. In a hospital where staff are not unionized, the law determines that the hospital CEO decides who is professional technical staff or service staff for purposes of both staffing committee membership and staffing plan coverage. OHA can only enforce staffing plan requirements for staff whose positions are covered in the staffing plan. OHA does not have independent authority to require that additional types of staff be included in the staffing plan. For more information about hospital staffing plan requirements and hospital staffing resources such as FAQs, webinars, and hospital staffing shorts, visit the hospital staffing website at www.healthoregon.org/hospital staffing.